In this video, we're going to talk about domestic abuse, assessment and management for the NACOSCE exam preparation. So, what is domestic abuse? It is a pattern of behavior used by one partner to maintain power and control over the other in an intimate relationship. We have different types of abuse. These include physical, sexual, technological, psychological or emotional, and financial abuse. The statistics in Canada says that 1 in 3 women and 1 in 4 men experience intimate partner violence. Indigenous women, women from the LGBT community, women with disabilities, and women from minority groups have reported to have higher percentages of intimate partner violence cases. What are the risk factors? History of abuse in childhood, alcohol or drug misuse, social isolation, economic dependence, and cultural norms. How to recognize the signs of domestic abuse in a NACOSCE case? The first thing we have to look for is physical abuse signs, such as unexplained injuries, frequent visits to the ER or the clinic, and signs of restraints. Behavioral signs, they include fearful or anxious behavior around partner, depression, anxiety, or low self-esteem, withdrawal for family and friends. Some of the red flags that we can encounter are partner exhibiting controlling or overly protective behavior, and usually the victim's stories of accidents are vague or the explanation does not match the type of injury that we are assessing. Patients may not disclose the abuse at first, but they may come to see the doctors for different reasons. We can encounter sleep disturbances, anxiety, panic attacks, depression, fatigue, frequent bruising, headaches, or chronic pain and gastrointestinal symptoms complaints. How to approach this scenario on the NACOSCE? First, we need to create a safe environment for our patient, ensuring privacy and confidentiality, making sure that our patient is aware of it. Always use a non judgmental and supportive tone. Guarantee that the patient feels safe. When taking a history, take a complete history, including the present complaint, the associated symptoms, past medical history, gynecological and obstetric history, family medical history, and social history. As direct questions, but always empathic ones. For example, do you feel safe at home? Do you feel threatened at home? Has anyone ever hurt you? And in case of doubt, you can always use the screening tools such as HITS or SAFE. Always ensure that you inquire about emergency plans to escape in the event of further abuse. The patient should always count with a support system and ask if friends and family are aware of the abuse or if they would like to have help from counseling services, community support programs, or legal. Ask about feelings or thoughts of self harm or harming others. Don't forget to ask if children are involved and if they are also in danger. Explain the importance of having a safe space for themselves and the kids, and question about any weapons at home and if they are in imminent danger. For the counseling part, always establish a good communication and active listening. Acknowledge the severity of the situation, reassure patient, and remark that domestic abuse is a criminal offense. Educate your patient and explain that domestic abuse is never the victim's fault. Also, make sure you offer referral and external services help, such as the police, counseling services, shelters, local domestic abuse services, and any other support services available, such as hotlines. In Canada, we have different resources. Please see them below. And you can always offer them to your patient in the NACOSCE examination scenario. Lastly, discuss the plan and the next steps. Once you have offered all the help to your patient, ask them what they want to do next and help them follow them through. Always schedule a follow up appointment and remind the patient that you are available for further counseling and support. Ensure continued access to resources. Make sure that the patient knows how to access emergency help if needed, and remind them to contact 911 services if danger is imminent. Also, important skills to demonstrate in the NAC-OSCE scenario, especially abuse, is to always show empathy and compassionate care, clear communication, cultural sensitivity, and patient centered care. Key points to remember for the exam: domestic abuse is often not immediately visible and may be difficult for patients to disclose. Your role is to listen, validate, educate, and offer resources. Address all the different types of aspects of abuse: physical, emotional, psychological, and sexual. Always ensure that your patient is safe. You can find the references below. Thank you.